record on this?
Hopefully you can see Kara's that is recorded. Yeah, that.
Why is it all trouble to say healthy adults?
Yeah, okay. I'll come with right now.
We are live, and I'll be running in 3, 2.
Good morning, and thank you for joining us today for the ADHS live webcast of the Arizona State Health Assessment. We are so pleased that you could join us. I'm Dr. Kara Christ. I'm the director of the Arizona Department of Health Services.
I'm Sheila Scholander. I'm the Assistant Director over Prevention Services at ADHS.
Hi, good morning. My name is Carla Berg, and I'm the Chief Strategy Officer at ADHS.
So to give everyone a little bit of background on what a state health assessment is, we have to do this as part of the department's accreditation efforts. So the Arizona Department of Health Services is an accredited public health department. And part of what we need to do is a state health assessment and a state health improvement plan every 5 years. The last state health assessment was done back in 2014, so our next state health assessment is scheduled to be published in 2019. When we do a state public health assessment, what we do is we utilize the framework where we assess health needs, we assess the state's capacity to respond to those needs, and then we match our needs with our capacity. That allows us to set priorities and our performance objectives, and it allows us to identify where we need to do further in-depth studies to look at specific needs of our states, and it helps us with our strategic plan and allocation of the state's resources. When we developed our Arizona Health Improvement Plan in 2016, the first edition included several leading health issues, including asthma and chronic lower respiratory diseases, cancer, diabetes, healthcare-associated infections, heart disease and stroke, maternal and child health, obesity, oral health, tobacco, and unintentional injury. These leading health issues were identified as priorities from the 2014 Arizona State Health Assessment. For every year that we are accredited, we have to do an update of our health improvement plan. So in 2017, our new release included a couple of additions, 2 additional leading health priorities, which included suicide and substance abuse, as well as 4 cross-cutting issues that we felt addressed several of the leading health issues, but needed to be addressed from a whole health perspective. And that included worksite wellness, access to care, the built environment, and school health. You can find the most recent update of our state health improvement plan, which was updated for 2017 and 2018 at azhealth.gov/azhip. When we've looked at this state health assessment, we really wanted to not focus on health issues, but focus on the continuum of health throughout a person's life. And so what you're going to see today is that we're looking at healthy people and healthy communities. We're going to show you outcomes across the lifespan, and we're going to break it up into different age groups. So maternal, child, and adolescent health, our healthy adults, and healthy aging. But we know that our communities also play a huge role in our longevity and our health outcomes. So we're also going to show you data on our neighborhood impacts, social influences, and tribal health. And then we're going to discuss opportunities that we've identified for health. A lot of the data comes from internal data here at the department, but you'll notice on every slide we've indicated where that data comes from. So if you're interested in finding out more, you can identify that data source. But the main data sources used in the state health assessment are data from our ADHS vital records, so that's going to include birth and death certificates, the behavioral risk factor surveillance system, which is a random selection survey that's completed every year on adults, and then the youth risk behavior surveillance system. And so that is completed every 2 years and is done in our schools in Arizona. So the first group we're going to look at is healthy people, so outcomes across our lifespan. When you look at Arizona's population, we are the sixth fastest growing state in the United States. And since 2010, the average population growth has been 1.4%. Based on the population assessment in 2017, our estimated population is expected to be over 7 million. Between 2010 and 2017, Arizona's largest population growth has been among residents ages 65 and older. The period growth rate for Arizona was 9.8%, which far exceeds that of the country, which was 5.2%. Throughout this time, though, Arizona's population has decreased among our infants by 2.2%. But when you look at our population, our fastest growing population was when it was in our residents 65 and older, but the largest percentage of Arizonans are between 20 and 44 years of age. So 32.7% of our residents are between 20 and 44 years of age, and then 24.1 are between 45 and 64. 1% are less than 1, 18% are between 1 and 14, and 6.7% are between 15 and 19. When you look at the race and ethnicity of Arizonans, more than 85% of Arizonans are white or Hispanic Latino, with our largest population being white. You can see that we do have representation from other race and ethnicities, but they make up a much smaller portion of Arizona's population. However, due to those small denominators between 2010 and 2017, that's been where our largest population growth has been seen in Arizona. We've had a 33% growth in our Asian population and a 29% growth in our multiracial population, but you can see the rest of the population still do have growth in Arizona. Probably not surprising to anybody that's watching this webinar, but based on the 2017 population estimates, over 75% of Arizonans reside in Maricopa and Pima counties. Those have our two largest population centers with Phoenix and Tucson, and that's where the most of our population resides. When we look at outcomes across the lifespan, this is always a very interesting chart. So you can see that our 5 leading causes of death are indicated by different colors. So you can see that teal color is our unintentional injury, which under 44 years of age is the leading cause of death, except for in our 1-year-olds. You can also see that cancer accounts for a significant number of deaths in Arizona, heart disease, as well as chronic lower respiratory diseases. But you can see how those leading causes of death change as we look at the different age groups. One of the interesting things to look at, though, is not just death by count, but when you look at death by years of potential life lost, because when you're assessing where you can make the biggest impact on the health and wellness of Arizonans, you're going to want to impact those areas that you can increase years of potential life. So when you look at the highest number cause of death, you can see that it's heart disease, followed by cancer, and then unintentional injury. But when you look at those deaths that are resulting in significant amounts of years lost or years of life lost, you can see that the leading cause of death in that category is unintentional injury, followed by cancer, and then heart disease. The top 3 causes of death, the unintentional injury, cancer, and heart disease, account for 228,000 years of potential life loss. Suicide is the 4th leading cause of death by years of potential life loss, so another potential area where we can impact longevity. One of the things that we have been monitoring here at the department is where Arizona ranks according to America's Health Ranking Annual Report. So for 2018, Arizona ranked 30th among the states. This was actually an improvement. For 2017, we were ranked 31st. They do identify different indicators where the state has positive impacts and where the state has negative impacts. And you can see that our positive impacts in Arizona are cancer deaths, are preventable hospitalizations based on Medicare readmission, and smoking. Our top negative impacts in Arizona are violent crime, air pollution, and our high school graduation.
Right. As we look at health throughout the lifespan, we'll begin at the beginning of the lifespan with maternal and child health. So starting with a look at the birth rate over the past 10 years, you can see a significant decrease in Arizona from 2007, when we had almost 103 births, to 2017 with 81,664 births in Arizona. So this is about a 20% decline in the state, and this is a similar decline as we see nationally. And a look at infant mortality rates. So Arizona is in the maroon color, and the U.S. is in silver or gray. So what you'll find here is that Arizona's infant mortality rates tend to be lower than the U.S., and this has been a difficult outcome for us to see some real change and progress in over the last decade. And then you'll see the trend lines from 2013 to 2017 with different races and ethnicities, and you'll see a disparity with African Americans and American Indians having the highest rates of infant mortality. And you can see the African American rates have declined a bit since 2013, with the American Indian rates increasing. And a look at infant mortality, so these are deaths to babies in the first year of life. The most common cause of death was congenital anomalies, or in more commonly known as birth defects or abnormalities. So that's a leading cause of death, followed by short gestation or prematurity, being born too soon, and low birth weight. Now we want to look at and consider the health of women before they get pregnant, because we know that that has certainly an impact and influence on the health of the pregnancy and the birth outcomes. So this is from the Behavioral Risk Factor Survey, asking women of reproductive age some questions about if their medical provider gave them any advice about ways to prepare for a healthy pregnancy. So you see here that less than half of women did receive advice from their healthcare provider about having a healthy pregnancy. We also looked at how many women are taking a daily folic acid or multivitamin, which is very protective for birth defects, preventing birth defects. And we see only 3 in 10 women are taking a daily folic acid. Now here's a look at prenatal care in Arizona. So this is a combination of years 2014 to 2017, where we see about 80% of women do receive adequate prenatal care in Arizona, but you'll see differences around the state, as well as based on race and ethnicity. So again, you see a disparity among our American Indian population, with only 68% receiving intermediate or adequate prenatal care. And across the state, you'll see some significant differences as well by county, with La Paz County, only 45% of women receiving adequate prenatal care, and that some of those border counties, Santa Cruz and Cochise, also having lower rates of women receiving adequate prenatal care. And a look at maternal mortality. So this has gotten a lot of attention nationally, because you can see it is on the increase. So maternal mortality is considered the death of a woman while pregnant or within 42 days of the end of the pregnancy from any cause related to or aggravated by the pregnancy or its management. So what we'll find is an increase in Arizona, which is the pretty turquoise line there, which we still have lower rates of maternal mortality than the nation, but you can see a really substantial and alarming disparity among American Indian population, whose rates are much, much higher than other races and ethnicities in Arizona. And I will mention, too, the other category here that you'll see does include African American women, which tend to have also high rates of maternal mortality. And a look at neonatal abstinence syndrome. So this is the group of problems that occurs when newborns experience exposure prenatally to certain drugs. So you'll see, again, an alarming increase in the rate of neonatal abstinence, a doubling of the rate across the state. And then you'll see differences throughout Arizona in terms of different counties being impacted by neonatal abstinence syndrome. So we know that this has certainly been impacted by the opioid epidemic that we've seen in Arizona. And a look at one of those leading causes of infant deaths in Arizona is sudden unexpected infant death, which is the death of a healthy infant who's not initially found to have any underlying medical condition that could have caused their death. So what we know now is that many of these cases are due to suffocation and unsafe sleep environments, but not all of them are sleep-related. But here we'll find that we've seen an increase in the rates of babies dying from unsafe sleep conditions in 2017. And we have some really robust data from the Child Fatality Review Report, where we find that 50 infants died in 2017 due to bed sharing with adults or other children. And a look at breastfeeding rates, which is certainly protective for the mom as well as the baby. So we tend to mirror the U.S. with our breastfeeding rates. So we have almost 83% of Arizona's infants have been breastfed. Well, you see a big decline by 6 months. It goes down to 26% are exclusively breastfed. Now moving on to children. So here we see the leading causes of death for children ages 1 through 14 and 15 to 19. So you see unintentional injury, by far the leading cause of death in these two age groups. For children 1 to 14, the second leading cause of death is cancer, and the third would be suicide. For adolescents ages 15 to 19, again, we see unintentional injury, so this will largely motor vehicle crashes, followed by suicide and then homicide. Now, I want to highlight tooth decay. It is the #1 chronic disease among Arizona's children. It is very common. More than 6 out of 10 children are affected by tooth decay in Arizona. Almost 2 out of 3 third grade children in Arizona are affected by tooth decay. So we know that nationally, Arizona has much poorer outcomes than the U.S. Our kindergartners have the third highest rates of tooth decay and untreated tooth decay in the nation. We know that tooth decay can have serious consequences, obviously including needless pain and suffering, but also difficulty chewing, which can compromise children's nutrition and can slow their development, certainly difficulty speaking, and lost days in school. And a look at the immunization rates in Arizona. So we know that the immunization rates in general have declined throughout the state over the past 5 years. This slide in particular highlights the non-medical exemptions for childhood immunizations. So these refer to exemptions due to parental religious or other personal beliefs. So you can see an increase just in over the period of 1 year, a significant increase among all age groups in the survey, child care, kindergarten, and 6th grade, receiving non-medical exemptions. So what this means is that in the event of an outbreak, over 5,000 Arizona kindergartners would potentially be at risk for measles. So we have over 7,000 children exempt from every school-required vaccination in 2017. Now a look at adolescent health. So this is from the National Survey for Children's Health. The U.S. statistic is in the gray or silver. Arizona is in the maroon on the bar chart. So what you'll see is that 71% of Arizona's adolescents have had a preventive medical visit, or you may think of this as a well child check. This is compared to about 79% nationally. Now, of those that have not had a preventive medical visit, half were insured. And a look, another access to care indicator here is among children with a special health care need, only less than 37% have a medical home in Arizona. So this is significantly lower than the U.S. at 43%. A medical home is considered primary care that helps facilitate partnerships and organizes care between patients, clinicians, medical staff, and families. And certainly for children with special health care needs, that's really critical to have a medical home and that coordinated care. And this slide looks at data also from the National Survey for Children's Health about adverse childhood experiences. Now, alarmingly, Arizona ranks last in the country as the state with the highest proportion of children ages 0 through 17 who have experienced 2 or more adverse childhood events. So about 30% of children have had 2 or more in Arizona. So what you'll find here is the most commonly noted adverse childhood events are parent divorce or separation, hard to cover basics like food or housing, living with someone who's had a alcohol or drug problem, having a parent or guardian that served time in jail, and then having seen violence. So we're concerned about adverse childhood events, certainly for the health and well-being of children. It also has long-term health outcomes, so think about this over the lifespan. We know that the more adverse childhood experience a person has, the more likely they are to suffer from a wide range of health issues as an adult. Everything from substance use disorder to depression to higher rates of obesity and heart disease. And a look at bullying among Arizona's children. So unfortunately in Arizona we have more of our children experience bullying than we see in the U.S., so about 25%. And you see it especially among our girls have higher rates of bullying than the U.S. And a look at bullying behaviors by grade. So this compares 8th grade in the maroon color to 10th grade in the blue and 12th grade in the light blue. So what you can see is that eighth graders experience the most bullying, tend to, bullying behavior lessens as we age, so it lessens by 12th grade. But you can see a high percentage, around 45% of kids see bullying but don't intervene as eighth graders. So that's certainly something we're working on through our bullying prevention campaign, and a high proportion of kids being bullied in Arizona. And this is data that's from the Youth Risk Behavioral Survey, where we found that more than 1 in 3 students report feeling sad or hopeless almost every day for 2 weeks in a row, so much so that they stopped doing some of their usual activities. So that occurred at least once within the past year. And sadly, about 11% of our young people have said they attempted suicide, which you can see is much higher than the U.S. percentage at 7.4%. And 4.7% of our adolescents attempted suicide required medical treatment. So certainly a disturbing indicator for us to consider. Now, a look at smoking among teens. So this is from the Youth Risk Behavior Survey for the past 4 years. So you can see a decline in Arizona in the percentage of teens that have tried smoking. So we're around 30% in 2017, which is about the same as the U.S. But the good news for Arizona is the chart on the right with Arizona in the maroon colors. You'll see in 2017, less than 10% of Arizona teens smoked. So that declined by half just in the past 4 years. So that's the fabulous news. So we often get asked, but does this include vaping? And we say, no, wait. There's more. Here's the next slide on vaping. So this is the bad news in Arizona, where we see 1 in 2 teens have tried vaping and 30% are currently using a vape product of some sort. So while it has decreased since 2015, still more than twice what the rate is in the U.S., and some of you may have heard that the U.S. Surgeon General issued an advisory this morning about vaping among our youth, and called to more action to be taken to curb vaping in the U.S. And in Arizona, ADHS will be launching a campaign to tackle vaping within the next month. But of course, this is a health concern because we don't know what's in many of these products, but many of them do have nicotine, which is highly addictive. And we also know that the research says that teens that vape are more likely to end up smoking. And then a look at other substance use among Arizona's youth. So this is from the Arizona Youth Survey, which is conducted by the Arizona Criminal Justice Commission. So this compares 8th graders in the green bar to 10th graders in the blue bar and 12th graders in the maroon bar. So what you'll find is that alcohol is still the most commonly used substance in Arizona. You'll see 36% of 12th graders used alcohol in the past 30 days, compared to 23% who have used marijuana. And then prescription opioid use, so this would be prescription opioids that are used not as directed by a healthcare provider. 8% of 12th graders are misusing prescription pain relievers. Then a look at physical activity among Arizona's high school students. We find 1 in 4 report being physically active at least 60 minutes a day. The good news here is that the percentage of youth attending physical education classes during school has increased in 2017, so it's up to 36%, which exceeds what the U.S. rate is. And a look at nutrition in terms of soda consumption. So this is from the Youth Risk Behavior Survey as well. Since 2009, we've seen more youth, and this is a good increase in the percentage of youth who did not drink sugar-sweetened soda within the last 7 days before the survey was conducted. So you can see we have a higher percent than the U.S. and have seen a nice increase in youth not drinking soda. And this is the last slide in the youth section. This is the teen pregnancy rate, which is an outstanding decrease over the last 10 years. This is about a 60% drop in the teen pregnancy rate over the past decade. So this is quite tremendous decline. We've seen the decline basically, so this is for females 19 years or younger. We've seen that decline in all age groups in that category and in all races and ethnicities, with the exception of African American teens haven't declined quite as much as the others, but you'll see the disparities noted on the right-hand side on the bar chart where we see American Indians or Alaskan Natives having the highest rates of teen pregnancy. Now I'll turn it over to Carla to talk us through the healthy adult section.
Thank you. So as we continue through our lifespan approach here, I will remind the audience that we are accepting questions that we would be able to answer at the end. So if you have any questions, please email those to our AZHIP email address, which is azhip@azdhs.gov. So continuing with our healthy adults, we're looking here at 2 age groups within our adult population. The 20 to 44, where we see unintentional injury is still the leading cause of death, followed by suicide and cancer. And when we look at our adults 45 to 64, we identify that cancer becomes the leading cause of death, followed by heart disease and unintentional injury. So taking a look at our unintentional injury and what does that look like for the state? Well, we see that both for Arizona and nationally, rates have been increasing in the last 5 years, where Arizona still has a higher unintentional injury mortality rate at 55.3. And what we see here also is some disparities within our racial and ethnic groups. And what we identify is that American Indians, for the American Indian Arizonans, their mortality rate for unintentional injury is more than 2.5 times higher than that of the whole state. In terms of means of unintentional injury, what we identify are poisoning and motor vehicle accidents account for the greatest years of potential life lost for unintentional injury deaths. And we will include that poisoning identifies opioid and other drug deaths, and motor vehicle accidents accounts for almost 150,000 years of potential life lost for our Arizonans, really impacting those as we had identified, ages 1 through 44 with unintentional injuries as the leading cause of death. Then moving to our intentional injury or our suicide mortality rates. Again, here we see a trend that is increasing both for Arizona and nationally, but Arizona's rate is higher. and we've seen that consistently. In the last year, Arizona lost more than 1,300 of our Arizonans due to suicide. And when we look at the means of injury, we identify that over 58% of suicides included firearm as the injury type, followed by suffocation, hanging, and poisoning. Taking another closer look into our suicide deaths, we identify that males accounted for more than 75% of these suicide deaths in the last year. And in the blue bars here, we see males compared to the gray females. And consistently in every age group, the mortality rates for suicide are higher for men than women. And we see the highest rates here within our male Arizonans aged 55 to 64 and 75 plus. Then looking at the next few slides will be looking at cancer. And what we identify here, we're looking at invasive cancer incidents where cancer has spread beyond the tissue where it started. And we identify that Arizona has lower rates consistently for the last 5 years when compared to the nation. But we identify in the map on the right-hand side that counties do have different cancer incidence rates here. Specifically in the dark blue, we identify Mojave County, where the cancer incidence rate is higher than the national rate. In 2015, both in Arizona and nationally, the most common cancer types included female breast cancer, prostate, lung, colon, and rectum. And then looking at our cancer mortality rates, again, we fare better than the national mortality rate, but we still have improvements and opportunities for improvements across the state in terms of screening for our screenable cancers and identifying early diagnosis. As when a cancer is diagnosed early, it increases chances for survival. In examining mortality due to cancer, we see similar trends across all 5 years, but we again identify Mojave County having the highest number of people dying from cancer, with that mortality rate being higher than the national rate. And then one more slide on cancer mortality. Here we're looking at males compared to females on the left-hand side, with our dark blue being male and our teal female. And we identify again that throughout the last 5 years, males have the higher mortality rates due to cancer compared to females. And when we look at our racial and ethnic disparities, we identify African American and white non-Hispanic Arizonans having the highest cancer mortality rates. When we look at our leading cause of death across the state, that is heart disease, we identify here our mortality rate, again, is better than the national mortality rate, but we know that it accounts for the deaths of over 12,000 individuals in the state in the last year. And when we look at our map distribution, we identify Mojave and La Paz County as having the highest heart disease mortality rates. Now, an area where the Arizona mortality rate is worse than the national rate is here in our diabetes mortality. And we see that although the diabetes mortality rate has been consistent in the last 5 years, we still continue to see disparities across the counties. Whereas our previous maps showed disparities with our northwestern counties, we identify that shift over here to Apache, Navajo, and Graham counties having highest diabetes mortality rates. Taking a closer look at our diabetes, we identify about 21% of American Indians are burdened with diabetes. What that means is over 1 in 5 American Indians are living with diabetes. Between 2016 and 17, the prevalence among American Indian Arizonans increased, while other groups saw slightly lower prevalence. And then shifting over to asthma, here this is taken from the Behavioral Risk Factor Surveillance Survey. And what we see here is a prevalence that appears to be going downward, but we'll continue examining this trend to see if that continues. And the 2017 national BRFSS data is not yet available, so we will add that when it becomes available. But when we look at our map here, some of the maps, due to behavioral risk factor, sample size, and number of responses, some of the counties needed to be grouped. So you'll note here our western Arizona counties were grouped together, as were our southeastern Arizona counties. But we identify that Navajo and Pinal counties had the highest asthma prevalence reported, self-reported for the BRFSS. Take a look at some of those behavioral factors that contribute to the most common chronic conditions and leading causes of death we just highlighted among adults. When we look at obesity and healthy weight, we see that Arizona continues to follow the national average for healthy weight, overweight, and obesity. And this is self-reported information from the BRFSS looking at 5-year trend. So we see here in Arizona, approximately 33, about a third of Arizonans reported that they were at a healthy weight. What that identifies then is approximately 30% were noted as being obese and 34% as overweight. If we were to look again at our racial and ethnic disparities, we identify that almost 3 in 4 American Indians and over 2 in 3 Hispanics report their weight indicating obesity or overweight. When we look at our adults smoking here, we have seen the percentage of Arizonans who report current smoking has remained below the national average. That's a trend, as was noted in the America's Health ranking, where we fare better than the nation. But we did see a slight increase between 2016 and 17. But when we look at our map, again, the western Arizona and southeastern Arizona counties were grouped due to sample size. We identify Yavapai County at almost 24% reporting current smoking. When we take a step closer look at our smoking rates, we identify there are disparities by incomes. Those reporting less than $15,000 in income report higher prevalence of smoking, as do African Americans at almost 18% reporting current smoking. So although we have seen a decline of adults currently smoking over the last few years and in Arizona, we note that these populations continue to smoke at higher rates. And as we looked at for youth, we take a look at our e-cigarette use here, much lower than the youth e-cigarette vaping, but we identify about 5.3% of Arizonans reporting current e-cigarette use, which has remained stable over the last few years. This question was initially asked in the BRFSS in 2016, so we're not able to identify a 5-year trend as of yet. When we look at our map around the Arizona counties, we identify Coconino County at the highest vaping e-cigarette use at 8.3%. And then looking at our binge drinking, again from our BRFSS data, we identify that Arizona has lower prevalence reporting binge drinking. And what we note here is binge drinking is defined as males having 5 or more drinks on one occasion and females having 4 or more drinks on one occasion. When we look at our counties, we see Yuma County reporting the highest binge drinking from the 2017 BRFSS.
Thank you, Carla. I'm going to take it over from here. When you look at our opioid epidemic in Arizona, we can see that that is continuing to increase across the state. So in 2017, based on our vital statistics and death reports, you can see that we had 949 deaths due to opioids. These deaths include both intentional and unintentional deaths. However, most of them are unintentional. One of the areas that we are monitoring is the proportion of heroin deaths. That has stayed steady at about a third of our opioid deaths. You can also see which ones are prescription and synthetic. Our fentanyl deaths would go into the synthetic opioid deaths. You can find a lot of data on our opioid epidemic response. We have a website that is set up at azhealth.gov/opioid. One of the interesting things is to look at the verified fatal opioid overdoses, both by age and gender, and you can see that there are different trends when you look at males and females. For our males, the highest proportion of deaths is seen in our 25 to 34-year-olds, our younger males, that tends to be due to the drug use, the drug types that they are using. When you look at our females, you can see that that shifts higher into our higher age population, to our 55 and 64-year-olds. We tend to see that those deaths are more likely associated with prescription medications. When you look at over 60% of our opioid deaths are in males, and our greatest percentage is among men, 25 to 34 years old. One of the things that we have been looking at in the state is our mental health, because we know that we can't have good health without mental health. While 1 in 5 Arizonans aged 18 to 25 had any mental illness in the past year, only 1 in 10 received mental health services during that same time. And you can see that decreases as you get older. So our 18 to 25-year-olds, 20% have had any mental illness, and you can see that 10% received services. When you get to our 26-year-olds and older, you can see that 17% have had any mental illness, but 12% of them have received services. And so this data comes from the National Survey on Drug Use and Health. On our BRFSS, we do ask about depression and frequent mental distress. 18% of Arizonans report ever being told they have a form of depression, so this is self-reported. And then when you ask whether or not they've reported having 14 or more days with stress, depression, and problems with emotions in the last 30 days, you can see that our American Indian and Alaskan Native population is most significantly impacted compared to our other ethnicities. But when you look across the time frame from 2013 to 2017, you can see that there was a sharp increase in those reporting that they've been told that they have a form of depression, especially between 2016 and 2017. Another issue that we are watching statewide is our sexually transmitted diseases, and you can see that we've had a significant increase in the number of sexually transmitted diseases reported to the department. They've tripled since 2000, and you can see that there are increasing rates statewide. The green states show our chlamydia reports, the blue is gonorrhea reports, and our red is early syphilis. And so you can see that our northeastern population is significantly impacted by sexually transmitted diseases, and then our southwestern part of part of Arizona. For syphilis, this is something that we are looking very closely at, and we do have a syphilis outbreak in moms and babies in Arizona. 1 in 4 syphilis cases are female, and our congenital syphilis cases, those babies that have been exposed and infected with syphilis while in utero, have doubled from 16 to 30. One of the populations that we are monitoring are our veteran populations, and you can see that we've identified opportunities exist to improve some of these health indicators. So the turquoise bars are our veterans, the gray bars are our non-veterans. You can see that they are impacted more by disability, frequent mental distress, and skin cancer compared to the general population. And in addition, our veterans reported more smoking than the general population. We have an estimated almost 500,000 veterans residing in Arizona, with our largest percentage of veterans from the Vietnam area. And again, that mental distress, when you're looking at that third bar graph there, that does include frequent mental distress for 14 days or more in the last 30 days prior to the survey. We're going to move into our healthy aging population. So this is going to be our population 65 and over. For this population, our heart disease was the leading cause of death, followed by cancer and then chronic lower respiratory disease. Alzheimer's disease is showing up as our 4th leading cause of death in this population, and then stroke as our 5th. In 2017, Arizona lost over 3,700 Arizonans due to chronic lower respiratory disease. You can see that our mortality rate was 43 deaths per 100,000 residents, and you can see that we've got kind of a diagonal pattern across the state of Arizona, from Mojave County down to Graham and Greenlee. It's the third leading cause of death for those that are 65 and older, but in 2016, we did drop slightly below the United States rate of 47.4. One of the things that we are watching closely here at the department is Alzheimer's disease. And in 2017, we lost over 3,000 Arizonans to this disease. The mortality rate in Arizona does remain higher than the national rate. It's risen to the fifth leading cause of death, replacing stroke. And among our 65 and older population, it's the fourth leading cause of death. So what you can see is this is age-adjusted Alzheimer's disease mortality on the right when you look at the map. And that shows the rate per 100,000 residents by county. And it ranges from 17.1 in Apache to 44.3 in Maricopa County. What we find is when you do the age-adjusted Alzheimer's mortality rate, it is higher among females than males. And while Alzheimer's did bump stroke, it still is increasing in Arizona over the last 5 years. We lost over 2,600 Arizonans due to stroke in 2017. The United States rate has remained stable over the last 5 years, and in 2017, we were above the United States rate. One of the things identified in America's Health ranking was that Arizona ranks better than the national average for preventable hospitalization among our Medicare enrollees. So that looks at the discharges for medical conditions that are determined from the Medicare provider analysis and review. So those that should have been managed in an outpatient setting but were admitted to the hospital would not be considered preventable hospitalizations. On America's Health ranking, Arizona ranked 8th in the nation, which is relatively good. We are seeing a decrease from, as you can see, from 51% in 2013 to just over 36% in 2017. Another thing that we look at is our healthcare-associated infections, and as you can see, there are several types that are being monitored by public health. And between 2015 and 2016, you can see that our healthcare-associated infections actually decreased for 5 of the 6 monitored infection types. So you can see that our central line-associated bloodstream infections, our catheter-associated urinary tract infections, our methicillin-resistant Staphylococcus aureus bacteremia, our Clostridium difficile events, and our surgical site infections after colon surgery all decreased. We did have a slight increase in our surgical site infections after abdominal hysterectomy, but overall the state is doing well for our healthcare-associated infections. When we look at unintentional injuries, one of the things that we do monitor is our fall injuries and that related mortality rate for Arizonans. And you can see that for our Arizonans aged 85 and older, the fall mortality rate is 18 times higher than their counterparts that are aged 65 to 74. We do have some disparities that are seen among our American Indian and Alaskan Native residents in Arizona. And in 2017, we had almost 1,100 Arizonans older than the age of 65 die due to fall injuries. And again, that greatest impact was those 85 and older. When we look at hepatitis C rates in the state, we see that the majority of people with hepatitis C are our baby boomers. And while rates of hepatitis C are increasing both in Arizona and nationally, Arizona's rates are higher. Arizona does see higher rates than the United States. So we do see a significant proportion of Arizonans in our baby boomer population, but we are seeing an increase in those that were born after 1978 that are getting hepatitis C, which may be linked to increasing injection drug use. Looking at our tribal health population, you can see that 35% of our American Indian and Alaska Native Arizonans are living below the poverty level, and they report the lowest percentage of very good or excellent health when asked what they feel their health status is. So when you look at the bar on the right, you can see that 25.5% of our American Indian Alaskan Natives are reporting the lowest percentage of being very good or in excellent health. These are the leading 4 causes of death among American Indians with 5-year trends. Again, when you look, you can see that we've got increasing heart disease and a slight increase in diabetes over the last few years, with our unintentional injury death rates staying approximately the same and fluctuating in cancer. And that's ranging from 2013 to 2017. When you look at where our American Indian, our Native American population is living and looking at gender, you can see that unintentional injury is the leading cause of death for almost all of those groups, except for our females residing off reservation. So when you look at our females residing on reservation, our males both on and off reservation, unintentional injury is the leading cause of death. But when you look at our females residing off reservation, cancer and heart disease are our leading 2 causes of death for that group. But unintentional injury is the leading cause of death, with a mortality rate of 139 per 100,000 persons. And the motor vehicle-related injury mortality rate, when you look at 2015, was 54.3. So this is something that I know our EMS and trauma systems program is looking at, on how to increase access to trauma care in those rural areas. Going back to our syphilis outbreak, our Native American and Alaskan population are more significantly impacted by this syphilis outbreak. While 1 in 4 syphilis cases statewide are female, in our Native American population, 1 in 2 cases is female. We've seen over 1,000% increase of female syphilis, and we've also seen a significant increase in our congenital syphilis cases who are American Indian. I'm going to hand it over to Carla, who's now going to talk about our healthy communities.
Thank you. So when we look at our healthy communities, we want to look at those social factors that impact our health. And really speaking to where you live matters. And we're going to take a look at different aspects of that. So starting off with our life expectancy. Based on the CDC's recent figures, the U.S. life expectancy has actually decreased, and it is currently 78 years and 7 months, or 78.6 when you look at that. Now, what is concerning is that an American that was born in 2014 is expected to live about 2 months longer than one born today. In Arizona, the life expectancy is noted slightly higher at 79.5 years, but we do identify that 6 of the state's counties fall below that national average life expectancy of 78.6. Now, this information is taken from the Robert Wood Johnson Foundation, Short Distances to Large Gaps in Health, with collaboration with the Virginia Commonwealth University. This slide looks at a focused example looking at certain Phoenix metropolitan area zip codes. And the alarming piece here is that we identify the zip code 85004, approximately around downtown Phoenix. That life expectancy is 14 years lower than that of the lighter zip code, what we know at 85258 in the Scottsdale area. So really here what we see is that 13-mile difference between these two zip codes could mean a difference of 14 years of life. Looking at some of those factors, we're identifying here education. This is again another area that we fared in our America's Health ranking as our 3 lowest. And what we see is that 14% of Arizonans have less than a high school degree, which is higher than that of the United States. And we see that consistently when we look at a high school degree and some college education. But interestingly, in Arizona, our percentage of Arizonans with a college graduate, who are college graduates, is higher than that of the rest of the country. Looking at poverty in Arizona, what we see here is over 17% of Arizonans are living below the federal poverty level, which is higher than the national estimate of 15%. But when we look at our map, counties such as Apache County has twice that percentage of federal poverty, with 36% of Arizonans there living below the federal poverty level. And the look at the unemployment rate mirrors that of federal poverty, but what we see here is the estimate from August identified 4.6% of Arizonans are unemployed, with again Navajo County having twice that at 9% of Arizonans in that county being unemployed. Now, when we look at what that impact looks like on health, why does that matter? What we see here is in terms of self-reported overall good health status, we see that those with a higher education and a higher income report being at a better overall health status. So that's seen here with those having at least a high school graduation at 84%, and those over $15,000 in terms of income having 85% reported overall good health status compared to their counterparts having lower overall health status by the BRFSS. Again, another area where we continuously have had concerns and lower rankings in our America's Health ranking is looking at our children in poverty. What we see is that 1 in 4 of Arizona's children are living below the federal poverty level. And when we take a look at what that means in terms of the assistance that they are receiving, we do see that about 32% of those children are living in households that receive public assistance, such as SSI, Supplemental Security Income, cash public assistance, or food stamp SNAP benefits. And I will note that this does not include WIC nutrition assistance, where that approximately 36,000 infants every year are served by the Arizona WIC program. When we take a look at our health insurance, what we've seen both in Arizona and nationally, health insurance rates have risen over the last 5 years, with approximately 86% of Arizonans have current health insurance. But when we see our county distribution, we see Apache County, for example, has lower than 80% of residents there having health insurance. So they're noted there at 76% in the dark blue. And we note that not only having health insurance does not indicate having a usual source of care. So this information here is taken again from the BRFSS. And we identify here is 60% and 61%, 60% of American Indians and 61% of Hispanics indicate that they do not have a usual source of care. So we identify some of those barriers that may be involved, whether that be accessing travel time, transportation, lack of appropriate providers, limited access, screening, and early treatment, all play a role into the health of an individual, especially here in Arizona, looking at this distribution. And then looking at that provider capacity level, this is something that we want to consider just with the need. What does our capacity look like? So Arizona suffers from a disproportionate distribution of providers. What that looks at is this health professional shortage areas, or the HPSAs. And Arizona ranks 37th in the nation in the number of primary care providers and 27th in the number of dentists. And a piece that we rank low in terms of our health ranking is looking at our mental health provider capacity. For mental health, Arizona ranks 47th in the country in the number of mental health providers. So we have gaps in capacities there to be able to serve the needs of Arizonans. Taking a shift to look at our food insecurity. So this identifies where a household reports that at one point or another in the year, they did not have the resources to be able to feed all members of their household. And so Arizona has consistently over these year trends here identified Arizonans, about 15% at some point in the year faced food insecurity. And then when we look at the map on the right, what that identifies there is our areas where we have low food access. So this includes areas where people lack the access to healthy and fresh produce, healthy food and fresh produce, potential negatively impacting the health of low-income individuals because they lack the means to travel to obtain healthier foods. And you see that trend here with our dark green or bright green, looking at a lot of our rural areas throughout the state. When we look at homelessness, this information is taken from the 2017 Point in Time survey. And what we see is that between the years 2016 and 17, the number of total homeless individuals increased by 3% across the state. There was a shift, and you see the teal includes those unsheltered compared to our brighter green of sheltered. Additionally, we do note that the Point in Time survey counted the number of unaccompanied homeless children, those under the ages of 18, and youth 18 to 24 who are not with a family. And at Maricopa County, that count was 320. For Pima County, it was 369, and the rural counties identified 352. Now, looking at when there is a household, we do note that affordability of household and housing may be an issue. So what we see here is that 1 in 2 Arizonans pay gross rent of 30% or more of their household income. The national average rent as a percentage of income is 42%. And we identify that housing expenditures that exceed 30% of household income have historically been viewed as an indicator of housing affordability. So we see that about 48% for Arizonans. And then looking at what those neighborhoods look like, especially for our children. This information is taken from 2 years combined of the National Survey of Children's Health Data. And we identify that compared to the US, fewer of Arizona's adults identified that they would identify their neighborhood where their children live is supportive. And that's asked of different questions, identifying people in my neighborhood help each other out. We watch out for each other's children in this neighborhood. And when we encounter difficulties, we know where to go to for help in our community. So that's aggregated and identified there in that 45% in the maroon. And then on the right-hand side, we look at that safety of that neighborhood. And this identifies children whose parents definitely agree that their children are in a safe neighborhood. And we see that that is approximately 60% for Arizona, with 32% somewhat agreeing and almost 9% saying somewhat or definitely disagree to that statement. And those social factors play an impact in terms of overall social cohesion. And what this slide identifies is the Social Vulnerability Index, which is taken from the lens of an emergency preparedness view. But what it looks like is it aggregates the social factors that are identified on the right-hand side of this slide, and it develops a Social Vulnerability Index ranking from 0 to 1, with the closer to 1 indicating the highest risk. So the darker blue counties are areas that have a Social Vulnerability Index closer to 1, where we identify that in the event of an emergency, we have some estimates of readiness or vulnerability issues within these Arizona counties. So now I will hand it over to Sheila for the rest of our slides.
Thank you, Carla. So one important consideration for healthy communities is our transportation system. And so this slide takes a look at our commute times for Arizonans. So you'll find the mean travel time to work is 25 minutes. This is statewide, so not restricted to our urban communities, which may experience much higher travel time to work. with 2% of us utilizing public transportation and 77% of us driving to work alone. So this is important because we know the more time we spend in our cars, that's sedentary time, that's not helpful to being more physically active, and those who use public transportation tend to get more physical activity. And certainly, more cars on the road can lead to congestion and stress and worse air quality, which leads us to our next slide. Air quality impacted by transportation, but lots of other things like dust and the mining and many other factors at play here. But this is from the U.S. Environmental Protection Agency that ranks counties on an air quality index scale. And so what we found was 3 of counties in Arizona are in the top 10 for having the worst air quality in the U.S. So you'll see Gila County, the 3rd highest, Pinal County, the 8th highest, and Maricopa County, the 10th highest. So we tend to think about L.A., Los Angeles County, kind of being the worst air quality in the nation, but you can see that unfortunately Arizona is well within the top 10 as well. And we know that concentrations of fine particles in the air are associated with higher risks of lots of different mortality causes, including lung cancer and cardiovascular disease. So one of the things that we'll look at in the state health assessment is our capacity to address health issues. And certainly one way of assessing capacity is the amount of funding available to address health issues in our community and in our state. So this is data from the Trust for America's Health that considered public health funding from state sources and federal dollars, specifically from the CDC, the Center for Disease Control, and HRSA, the Health Resources and Services Administration. So it found that Arizona receives about $50 per person for public health from those sources, which is well below the national average of $86 per person, and ranked us 47th in the country in terms of that public health funding. So that is the summary of our data. Now we're going to move on to a look at some of our opportunities to improve health. And certainly there's much great work going on across the state to improve the health of our communities and our people at the local level. So our county health departments are in partnership with us, certainly, doing the work at the local level. And most counties have community health improvement plans. So one of the things that we wanted to take a look at is what health priorities have been articulated by the counties in those community health improvement plans. So this gives you a snapshot of what those priorities are at the local level, and very similar to what we had selected back in 2014 as the state health priorities. So an important consideration as we start thinking about how to set priorities in the future and what interventions we might want to select and consider, we ought to think about, where does our health come from? What most impacts it? So this is research that has been done, and you'll find different variations of this percentage breakdown, but essentially what it demonstrates is oftentimes we think about medical care and health care having the biggest impact on our health outcomes, and the research really shows that it has it impacts about 10% of our health outcomes. Genetics is about 30%, and then our own individual health behaviors around 40%. So that would certainly be things like smoking, alcohol use, our nutrition, and so on. And then those social and environmental factors at play, like housing, transportation, our education and poverty, really important influences on our health. So as we move forward, we certainly want to move more towards health equity. And this is an infographic from the Robert Wood Johnson Foundation that we thought did a really nice job of displaying the difference between equality and equity. So equality, pretty much giving everyone the same thing and hoping that they can achieve good outcomes, versus equity, considering that different populations have different needs and we have different starting points. So an equity approach really emphasizes providing opportunities that will optimize health for everyone. And that is really where we want to go as a state. And obviously, considering all the disparities and the differences in health outcomes you saw in the presentation, you know, we still have a lot of work to do to move towards health equity. And so at this point in our process with our state health assessment, we're really interested in your input and your questions. And so I'm going to pause for a moment and see if we've received any questions yet from the audience. No questions yet. Okay, so we do want to give you all an opportunity, though, to help inform the development, the further development of the state health assessment. So where we go from here is we are still analyzing some data and working on a capacity section in the state health assessment, and hope to produce the document to be publicly available by probably March or April of 2019. So what you've seen today is just a snapshot, kind of a sampling of some of the data that will be available in that report. But we have a survey available to gather your thoughts on kind of what takeaways you have from the data. If there's any additional analysis that would be helpful in understanding what's happening with the health of Arizonans, ideas on how you take action on the data, based on the data, and then how you would prioritize resources and activities. And so we have a long list of topics to choose from for priorities. And this will just give us a sense of some preliminary thinking about what our priorities might be moving forward. So we will, as part of our assessment process, we'll be resetting health priorities to prepare for our next version of our state health improvement plan, which will be published in 2021, I want to say, which seems like a long ways away, but we will have to start setting those priorities and building out the strategies and actions in that plan close to the end of next year. So we really appreciate your help and your thoughts in all of that process.
And I will add, while we have not received any questions right now, if you do have any questions at a later time, feel free to send those to our AZHIP email, azhip@azdhs.gov, and we will go ahead and answer you directly.
joining us for the state health assessment. Again, you can email any questions or comments. We will also be posting this on the web, so encourage your friends and colleagues to take a look through the data and help us answer those questions and take the survey. So we hope that everyone has a great rest of the day. Thank you.